Welcome to Sex, Love and Science with Lorraine Muratore, clinical psychosexual therapist and relationship expert. This podcast explores sexuality, relationships, and the many facets in between, aiming to normalize sexual conversations, issues that we all face. Let's take the taboo out of sexuality and open up the conversations for a better sexual existence. I would like to begin by acknowledging the traditional owners of the land on which we are meeting today, the Wurundjeri people of the Kulin Nation. I pay my respects to their elders, past, present, and emerging. Welcome back. Today's episode, I have the lovely Lorraine Pentello here. And Lorraine is quite a superstar in the sexuality world. She has a multidisciplinary approach to sexuality. Was that how I could say it?
Yeah.
And so I saw Lorraine speak years ago at a SAS event, and Lorraine, you spoke about penis health predominantly, which I thought was so helpful and fascinating. And for context for everybody listening today, that I've also sent so many clients, and I do often recommend Lorraine, particularly because Lorraine is hands-on and I'm not. So let's start there if that's okay.
Yeah.
Because a lot of people don't know what hands-on sex therapy, sexological bodywork is.
Yep. The sexological bodywork was developed by someone called Dr. Joseph Kramer back in the 90s. And it stemmed from the AIDS crisis. So people were wanting to be safe and be connected and feel their sexuality and be part of a community, and they didn't know what was happening. So he developed this wearing gloves and safer sex practices, and it's sort of grown into a modality in recent times. So the basics of sexological bodywork are touch on genitals is one way from practitioner to client. It's done only with hands and wearing gloves. It's mindful, body-based practice. So there's focus on breathing, breath work. There's focus on being mindful of the touch that's been received. We bring in sounds, so making sounds and encouraging sounds. We bring in movement, so movement of the body, movement of the pelvic floor, and also presence, sort of being present in your body and noticing what's happening in your body.
That is amazing, because there's only so much, like, I can talk about it, I can teach that, I can get people to do some breathings in session, but that's where I draw the line.
Yeah.
Right? Yeah. And so who would be a good candidate for this type of modality?
I think anybody really who wants to learn about their body. I mean, there's so much sex negativity in our culture. We're not taught how to feel our bodies, and we're not encouraged to express ourselves sexually. We've got this kind of stunted thing around sexuality. One of the things in sexological bodywork that we're encouraged to do a lot is self-pleasure as well, which is quite taboo in mainstream society. Touching yourself, enjoying touching yourself, making a noise while you're touching yourself. One of the main things about sexological bodywork is learning about the body and learning new things. And I think everybody could benefit from learning something new about their bodies.
Totally. And that's actually I like that point, because you didn't really answer that it's anybody for this type of issue. You don't take a pathologizing approach. You're saying anybody who wants to learn about their body, really this could help. So I think I love it. I love it.
Totally. Yeah. I mean, it does help to work with issues as well. If someone's struggling to feel orgasms, someone's struggling to ejaculate in a manner and a time that they want to. I don't like to say premature ejaculation. I really don't like that terminology. Again, it's pathologizing, but to lengthen that orgasmic trajectory or to speed it up. Sometimes people struggle with orgasmic sensations. They can't ejaculate or they can't orgasm. Erections as well. That was the talk that you saw me do at the very beginning. Learning how to get stronger erections. Exploring the anus as well, exploring inside the vagina. Some people haven't ever had that I think a lot of people haven't ever had that kind of touch. It's not medical. It's not the touch of a lover. It's the touch of someone who's holding space for you to explore what it feels like.
Yeah. And I think you're right. Nobody really thinks about that space.
Yeah.
It's either, it's for my lover or partner, or it's for a doctor. And the contact is then not sexual. So
Yeah.
what, it just provides so much opportunity for people who are facing something that's distressing or not, I think.
Yeah, definitely.
As a practitioner, right, identifying as gender fluid, do you find anybody who comes in, so any client that particularly or that might identify as female or male, would feel comfortable with a particular gendered practitioner?
Yeah, I think that depends on the person, but I do see a lot of straight men. And I present very feminine looking. I'm assigned female at birth. So I think a lot of straight men feel really comfortable working with me. Genderqueer people, I feel like they also feel comfortable working with me because I am genderqueer as well. It's like I fit into the two boxes. Yeah. And I do see women as well, not as many women as I see men and genderqueer folks. And I think they feel comfortable working with me because I'm a woman. I'm seen as a woman. I'm not a woman, but they see me as a woman too.
Yeah. Well, that's interesting. I'm just kind of like looking at your client base, right? So most of them would be straight males, and I guess a little bit, but only a little bit of women. Why do you think that might be?
I think that's my marketing. I put myself out there as someone who's queer and works with straight men. So,
okay. Or I was just wondering if it could be more of like more straight men, for example, are looking for this particular service, and maybe potentially women don't know it's available.
Oh, I don't know. I do know a few practitioners in Melbourne who work solely with women who are very sort of womb centric, and they are quite busy. They get booked out a lot. I find women are out there looking for therapies. I find some men are, but lots of men aren't.
Okay.
Yeah.
Interesting.
I do think the body-based approach does tend to attract men more maybe than a talk-based approach. I don't know. I've not worked in the talk realm, so that's maybe a question for you.
Yeah, good point. Well, I guess, I would say I see, genderqueer. I would say that, I would say I have probably a very even amount of genders. So, interesting.
Yeah, it is fascinating, isn't it?
So, all right. So I'm just trying to picture who's coming to you, right? And sounds like, do you have people who just want to explore themselves, kind of what you spoke about, or are these people with issues?
I do have a few people come to explore. The majority of the people that I work with are coming with trauma. That's sort of my area of expertise, or they might have had gender confirmation surgery, or they might be sort of not comfortable with their genitals because they were born into the wrong body and they feel the disconnect from their genitals too, or maybe they've got some scarring from some top surgery or something like that. And there's always something to explore in there emotionally as well as physiologically, I think. So there's so much comes up.
Yeah. So tell me. So I guess trauma is your main area. Tell me. That you just provided some fascinating examples of what people might come to you for. Yeah. So tell me. So I know you work in EFT. Is that tapping, right?
Yeah, tapping and EMDR, the eye movement desensitization reprocessing.
Yeah, I am a big fan of EMDR. So tell me how you incorporate all of these for someone who might have experienced trauma.
So right at the start, one of the ways that I work with people is to figure out whether sexual contact and sexual arousal is a resource or a challenge. And depending on where that sits depends on how we work together. If it's a resource, like quite a few straight men do find it to be a resource.
Yep.
We can tap into sort of starting with sexological bodywork and finding where their arousal and their positive sensations are. And we can leverage the positive sensations to dip into a little bit of the discomfort and then come back to the positive. So we're using that positive sensation to create a bit of a base for them.
Yes.
And then we're dipping into the negative feelings and coming back to it, either with some bilateral touch on their body, or some breathing, or some noticing where the sensations are in their body to keep them grounded. If sexual arousal and touch is a challenge for them, which again, that any gender, that can be a challenge, then we work really, really slowly. So we find some kind of resourcing and grounding. Maybe that's some somatic techniques like moving a certain way, doing some breath work, finding a safe place in their imagination where we can rest, helping them to calm their nervous system first before we go into the more sort of challenging processing stuff. And that could take a really long time for some people. One of the things I've started doing a lot recently is cuddle therapy. And that can just be amazing to start the sessions with that. Like I said before, if people find it really challenging, if they find intimacy and connection challenging, that's not the place to start. For them, that might be the place that we're aiming towards.
Correct. Yeah. For some people that cuddle, well, I know for a lot of clients that I see, that's their safe place. That's kind of their starting point.
Yeah, totally. But if they've got a lot of attachment trauma, it could be a really frightening thing for them as well. So building up to that too. I like to work with a 3 phases treatment of trauma. So phase 1 being calming the nervous system, using somatic practices to help them calm. And then there's the processing part where we could be mixing body work with EMDR, sexological bodywork and EMDR, remedial scar work as well, because there can be emotions trapped inside scars, especially if there was an emotional attachment when the scar was made, if it was made from an injury or an operation. It can be quite challenging when that scar starts to release with body work. There can be trauma and emotions released from that. So doing some processing when that happens. And then there's the 3rd phase, which is the integration part. And I find that sexological bodywork can often be part of that integration bit of like teaching people how to use their bodies now. There is the trauma response has left their body. What do I do with it now? And that's really wonderful where the referral comes in as well, like working with someone like yourself to integrate that experience and make sense of it. That's amazing.
Yeah, it's such a journey that you take people through.
Yeah.
Just kind of reflecting on those 3 phases, it just sounds like you're just so conscious of each stage or level, right? I think what stood out for me was the releasing of trauma during scarring. I know a lot of clients don't think about that. I don't think a lot of people out there listening would be thinking that there's trauma in scars.
Yeah, it's I've experienced it myself of receiving the body work and working through my own trauma around my scars. And sometimes scars might not even be visible from an injury. They could be an adhesion in the guts. That was where a lot of my scarring came from. It came from having sex when I wasn't ready.
Yep.
It came from food allergies. It came from blunt force violence and things like that. It came from moving my body in a particular way. I used to be a pole dancer. I used to do stripping in strip clubs and wear heels and move my pelvis in a particular way. And that repetitive movement can create like a scaffold in the body of like almost like an extra ligament or a tendon growing in there as an adhesion that needs to be released and worked through.
Yeah, wow. So you've been through this yourself.
Yeah, totally.
I think that's a good point is when we take the journey ourselves, we know how important and what it entails, and I guess what it looks like on the other side.
Yep. Yeah, it was when I first did my sexological bodywork training. I found it very challenging, and I feel like probably looking back, everybody found it challenging. It is a very challenging thing to learn, that we're doing lots of really unusual things like self-pleasuring in a room together, having self-pleasuring homework, being touched and touching other people in intimate areas. It is challenging, but I didn't realize just how much scarring and how much trauma was in my body. And it all got released during the training. So that's what led me to EMDR, was finding that particular therapy myself. I read about it in Bessel van der Kolk's book, The Body Keeps the Score, and I thought, this sounds amazing. And it really worked. But going through that process myself and mixing EMDR with body work as well, I had, my therapist was on one side of the road and my body worker was on the other, and I would cross over and I would practice. Should I do EMDR first and body work afterwards, or body work first and EMDR afterwards? And I found that for me, doing the body work first really primed my body and relaxed me into being able to do more processing with the EMDR, rather than doing the EMDR processing and having like all these little bits that I needed to mop up emotionally with the body work. And that sort of led me to where I am now, working on other people doing it that way.
That's incredible. I think the point that I really liked hearing you make was, which one comes first? Do you do the body work or the EMDR? And I think that's probably a really a poignant point for a lot of people to think about, is because I think a lot of people, who like yourself, or I have trauma, or I have a scar, or there's something going on. I can feel that, and then I don't know a good place to start. I don't know where to start, and I don't know which road is the best one first.
Yeah.
In your professional opinion, would you say that, it's really dependent on the circumstances, the individual? Like, how would you kind of formulate or give advice on, if there's a general way to advise on what to do?
Totally. Yeah. I think it does boil down to the individual. I think most people, if they're coming to me, they've seen that I do body work, they've seen that I do hands-on. Most people tend to want to go hands-on first, the same way I did when I was receiving treatment, and I still do receive treatment. It's an ongoing process, the healing process. But every now and again, there are some people that the hands-on doesn't work straight away for them. That's something that they want to work up to. So maybe starting with the somatic practices and EMDR and working up to body work is right for them. I think the best way to find out is this is what I encourage my clients to take a big deep breath, close their eyes, and just feel into their body. And when they imagine doing some kind of EMDR work, going straight to the root of their trauma, what does that bring up in their body? Does it make them feel frightened? Does it make them feel resistant? And then feeling into, do they want to receive some touch? Where do they want to receive it? And noticing what that feels like in their bodies. That's the kind of how I find and help my clients find what's going to be best for them in that moment.
Yeah, I think that's beautiful. And I hope people can take that away just listening, is you're asking people just to tune into their body and listen to themselves.
Yeah.
Which again, it's really hard for a lot of people to even think about doing that.
Yeah.
And I guess we're lucky when we get to guide or assist that process.
Totally. Yeah. And if they don't feel ready for that, maybe they need to come and see you for talk therapy first.
Yeah, exactly. Question about breath work. You mentioned it a little bit. And I'd be curious what maybe if you had a little trick or a tip, a breath that is one of your go-tos, that is something simple that people could just practice at home. Is there anything that you feel comfortable sharing?
Yeah. This one, I got this one from Dan Siegel. He's one of my favorite teachers. And it's just following the breath in the body. For some people, this could be challenging. For people with trauma, sometimes breath work isn't right for them. But they'll know once they try it.
Yep,
would you like me to guide it?
Yeah, do you mind? I think that's beautiful.
Totally, yeah. But getting somewhere comfy and just noticing that connection that your body's making with the world. So noticing your feet on the floor. If you're supported in a chair or a bed, noticing your back and your bum supported. If it feels right, closing down the eyes. If not, just letting your vision soften a little bit. And just allowing yourself to arrive in this present moment where you are. If your mind starts to wander, just lovingly bringing it back to this connection. And then when you feel ready, just noticing where you can feel your breath moving. So we're not forcing it, we're not changing it, we're not controlling it. We're just noticing where we feel that movement. So it might be in your abdomen, might be in your chest or your shoulders or your nostrils. And just following with your awareness in and out where you feel that movement. Letting go of getting it right. And just following. And if your mind starts to wander, just lovingly bringing your awareness back to this movement of breath in and out of your body. And see if you can keep an awareness of perhaps that connection with the world, or perhaps the connection with your breath, as you start to bring your awareness back to the room. When you're ready, opening up your eyes.
Wow. I'm feeling quite grounded.
Yeah, me too. I love guiding those. It grounds me as well. I join in.
Wow. Thank you. Thank you for that. And yeah, I might have to direct anyone to this episode who needs a grounding exercise. That was beautiful.
Thank you.
That was you. Your voice is very safe and comforting.
Thank you.
You should be on an app, Lorraine.
I'm a bit of a technophobe. Is that what you call it? So I'm doing some EMDR on that. I will get there.
Okay. All right. Excellent. I would, I'd definitely be helping you advertise that app, because I think that'd be amazing. So I do enjoy the work of Dan Siegel as well. Can you tell me, I guess how you use some of that work in your practice?
I love the part where he talks about the mirror neurons and the compassion and tuning into other people's experiences. Like that feeling of when you walk into a room and someone is acting like they're very happy, but you can feel the sadness, and you can feel that they're masking some kind of sadness in there. They don't want to let you know that they're sad, but you can just feel it because you're in the proximity of them. That concept plays out in a lot of my work, because I'm always using what's happening in my body as a barometer for what's happening in the session. And it's not always accurate, because I could be bringing my stuff in. So I'm always checking with my client if I feel something like, and this is a bit spooky. My bodywork, one of my bodywork teachers spoke about this with me, and I don't think he knew anybody else could do this, but he said, if I get a feeling of a pain in my shoulder or something that wasn't there before the client came in, I check in, what's happening with your shoulder. And often they have a pain in their shoulder. Not every time. It could be just the way that I'm leaning. It could be the way that I'm moving my arm. But often it is that they've got a pain in their shoulder. And it's like a mirroring in my body of what's happening in their body. And being able to work through that. And sometimes emotionally as well. Like if I feel an emotion come up in my body that doesn't feel like it belongs to me, I'll check in with the client. What are you noticing now? What are you feeling? And often it's coming from them. Not always. It can be coming from me too, but often it is coming from them. And explaining that concept to people, it can be quite mind-blowing. And
yes,
we co-create the experience together. It's not about just them or just me. It's the in-between. It's the relational part. And I really love that concept of Dan Siegel's. And the other one as well, just thought of another one. My brain's ticking now. The river of integration, where on one side there's chaos and one side there's rigidity, and we can get stuck on either side. But an integrated life is moving through the river and then bouncing off each side. So sometimes we are chaotic when there's changes happening. Sometimes we are rigid when we need to stiff up a lip and get on with it. And there's no room for chaos. And then other times we're flowing down the river. Yeah, they're my favorite ones.
And I could see why. No, thank you for sharing those, because I think, they're so important. And I mean, we could probably talk here for hours on just those concepts and how they would, I guess, kind of translate it into our work and people's psyche and sexual and even emotional. And I think that's just two amazing things. I think, the thing that first, when you spoke about the person, at a party and you can feel them, I don't know, this is the first thing that came to mind for me was people who are very good at understanding their lover at that time, right? Like understanding what's turning them on, turning them off. And they're very tuned into their body and the sensations. And they might not even having to be doing that verbally because they're very attuned to what that person's feeling.
Yeah.
That would probably be an advanced skill, I'd imagine. Would I be wrong to assume that?
It is. There's some people just naturally are like that, and then other people need to learn that. They don't have that skill. You reminded me when you were talking about that sort of attunement in what's happening in your body and other people's bodies, of a phenomenon that comes up for me personally, and I've noticed with a lot of my clients, is the sort of ties in with the fawning, people-pleasing response of feeling other people's sexual arousal and going with that rather than receiving touch. That can be kind of a challenge. And that's sort of when someone else has an orgasm, kind of falling in with their orgasm instead of experiencing our own orgasms as well. That's quite an interesting one, I find.
Oh, absolutely. I think that most people who would come into my practice, a lot of people would struggle receiving.
Yeah.
And doing exactly what you said, is being able to be in their own bodies to accept and experience that arousal and that orgasm. And instead they are with the other.
Yeah.
That's would you be able to assist people learn how to receive?
Yeah, that's a lot of sexological bodywork is that one. That is a huge one. Yeah.
So if you want, is there any tip that somebody can maybe start at home before they came to see you on how to, maybe prep themselves on receiving? Is it, is that even a thing?
Yeah, they could. I mean, they could listen to that breath meditation that we just did while touching themselves. There's an open invitation to touch yourself while you listen to my voice. That would be a good prep.
Excellent. This is why people need to pay for it. Yeah. Okay. All right. Well, there we go. That's the moment of reflection for this episode is do the guided voice, breath work and grounding, and then maybe potentially do it touching yourself and see what comes up, and see if you can't do it touching yourself where the discomfort lies. Because I can imagine, and do you help people, and I guess you kind of spoke about that, it's finding the resistance, right?
Yeah. And also sometimes people can be surprised at what they're not resistant to as well.
Oh, really?
Yeah, I thought I was going to find resistance there, and actually it's actually there isn't any. That can be a really nice surprise.
Oh, that's actually so affirming to hear. So then there are people who then can easily go into receiving and feeling within their body.
Yeah. Anal touch is one of them. Actually, quite a few people are surprised at how nice anal touch feels, and they thought it was going to be uncomfortable. They thought they weren't going to like it. But I find that it works nice if you have some arousal built up in the genitals first, if that's an easy, accessible area for you to feel arousal, building some arousal in the genitals and then doing some anal touch can be a surprise of like, oh, that was a lot easier than I thought. And vice versa. Some people who struggle with genital touch, but they're okay with anal touch, like that sounds like it could be a thing, but it is. It's quite an easy access point for people who are struggling with genital touch.
That's fantastic because people are very it's taboo. I'm not quite sure why, but it's just people are very kind of sensitive about that area.
Yeah, and there can be so much healing just from relaxing the anal sphincters, the effect that it can have on the autonomic nervous system and sleep regulation and being able to calm, being able to digest your food easier. Like just talking about it now, I can feel my guts just relaxing.
Yeah. Wow. So technically, gastroenterologists should be sending their clients to you as well.
Yeah. Especially if they can't figure out what the problem is, then I would definitely say it's autonomic nervous system dysregulation. And anal massage is fantastic for that.
Wow. There you go. Well, Lorraine, I can't thank you enough for today. Like, to be honest, my brain is going to be thinking about everything that we spoke about. And like, I'll listen to this again and think, oh, we could have talked about this and I should ask her about that. And
Yeah.
let's talk about this. I really, really appreciate you taking the time, and I might have to reach out again with a million other questions if that's okay.
I love that. It's been so wonderful chatting with you, Lauren, and so lovely to meet you finally.